what are some signs that your baby may have a tongue tie? And this can be very confusing to a lot of moms because what can seem normal or abnormal could be very confusing. So painful latch. It's okay to have pain in the very beginning when you're nursing. I think that's normal for the first week or two. And then after a week or two, that pain should go away. You should not dread nursing your baby. So that would not be normal if you're having that kind of pain. If your baby's falling asleep in the middle of a feed and you're having to undress your baby and wake your baby, and it's, this has been going on for over a week, that's not normal. If your baby's mouth breathing's never normal in children or babies. They should always be breathing through their nose. When a baby has to mouth breathe, that's a big compensation for a baby and actually a lot of work for their body. And when they're mouth breathing, that's a big sign of a tongue tie, and it's a big deal because that tongue guides the growth, so we want to catch that as early as we can. I hear a lot that, hey, my baby's gaining weight, they probably don't have a tie, or they may go to the pediatrician and mom's noticed other signs of a tongue tie like poor latch, baby's popping on and off, baby's gagging and choking, baby won't take in enough milk, they always seem hungry, mommy's breast isn't emptied, and the pediatrician might tell them, or whoever they go see might tell them, oh, well, they're gaining weight, they're fine, you're fine, they're gonna be fine. And it's not fine, because even a baby with a tie can still gain weight because maybe mommy has amazing supply and the baby's basically drinking out of a straw and not having to work for the milk. And the most important thing with breastfeeding is that the baby works for the milk, because the way that they use their mouth in breastfeeding causes proper growth and development in the baby. If the baby is gagging, choking, coughing on a bottle on a consistent basis, they should not be. They should be able, that tongue should be able to have a great peristaltic wave and keep up with whatever milk mommy has. Sometimes a mom may have an extremely big letdown, and that can be a little hard for the baby, but most babies should be able to take whatever letdown mom has. So if that's an issue, you probably need to have it looked at. If baby's on a bottle and milk is leaking out, that's not a good sign, and you need to come in and get that checked for sure.